Greetings, health practitioners and all those interested in health. I'm Chris and I'm a medical specialist, now retired, of some 40 years experience, and I cover most medical specialties, having worked in most areas of medicine. The purpose of these podcasts is not to give any medical advice. If you have any concerns about your treatment, you should consult your health practitioner. As usual, the focus of these podcasts has been on a work written by two medical academics, Professor Buckmaster and Professor Harris, who've written a book called Hippocrasy: How Doctors Are Not Practicing According to Their Oath. These doctors for the last 20 years have been trying to introduce science to medicine. You might ask yourselves, aren't doctors scientists? The truth is that over the last few years the focus has very much changed from helping patients and advancing science to making a profit. You'll note on the banner of this podcast there is a book, This Must Not Happen Again: How Government is Wasting Your Money and Damaging Your Health, written by me, that goes into a number of cases of doctors who become multimillionaires as a result of their medical practices. One example is given of a surgeon who charges a mother $50,000 for inserting 5 sutures into her child. As I said, this podcast will cover most areas, and today we are looking at surgery. It would surprise you that most operations that are performed by doctors, particularly in the orthopaedic area, are of questionable benefit. Let's start with low back pain. Operations performed on the back to relieve pain are generally ineffective. This even applies to a situation where in a scan of the back you can isolate a nerve that's being pressed on by a disc. It would seem obvious that relieving the pressure from the disc will improve the back pain. But surprisingly, generally, this is not the case. Spinal fusion, although a very expensive operation that makes doctors a lot of money, generally does not help as much as losing weight and taking exercise. Let's consider the case of knee surgery. The most common surgery that's performed on the knee is an arthroscopy. This involves inserting a scope into the knee to look at the meniscus, which is a soft pad which the upper bone of the leg rests on, called the femur, and slides around. The doctor inserts the arthroscope and tidies up this damaged cartilage. But once again, this operation has now been found to be generally unnecessary and ineffective compared to weight loss and rehabilitation. This also applies to the most common operation that's performed on the shoulders, called shoulder decompression. Here, the surgeon polishes the joint, the top of the bone, with the tendons slide across in order to make the tendons move more easily. Again, this operation is generally unnecessary and ineffective, but there are a variety of other operations which patients undergo through orthopaedic surgery that are not helpful, and these include repair of ruptured Achilles tendon, surgical repair of torn hamstrings. Imagine you go to your doctor and he says to you, "You should have an operation." What do you do then? You go and see another doctor and he says to you, "Under no account should you have this operation." What do? Do you get a third opinion? What the authors of our book point out is there is sufficient science now to help you make a choice. Operations which are solely to relieve pain are not as effective as operations where there is a clear injury or sign. Take osteoarthritis. Mostly, joint replacement operations of the knee or the hip are not as effective as extensive weight loss and rehabilitation. To the average person, it seems strange that if a joint has been worn out, how does further exercise and rehabilitation improve its function that makes surgery unnecessary? But that is the case. Take the case of private hospitals. It's been found after most joint replacement surgery that keeping the patient in for several days to undergo expensive physiotherapy is not as effective as discharging the patient almost immediately to carry out their rehabilitation at home. The motto is this: work through the pain. After all, your leg's not going to fall off.